How many of you are frustrated with your doctors or specialists? Specialists who are so special that that's all that they can see is just their speciality. And when they do that, it's kind of a mixed bag because it's a wonderful thing that they can hone in microscopically on something. But at the same time, they kind of lose sight of the whole issue, or let me put it this way, they can lose sight of the whole issue and not really treat it functionally or get to the root of why a problem. I think we live in a medical situation or life or what's the word? Climate in our country, which is you go to a doctor to fix something, not fix the root, really. You give them something or a treatment or a condition, and okay, let me fix it, whether it be a pill or an immediate therapeutic, but not really fixing the real problem. I know, does it sound a little bit like a rant? Well, it's actually a really big rant because I am so frustrated with this, especially when it's not something that is like most people are dealing with or where you can read a lot about it. And boy, do I feel sorry for so many of you that are dealing with some like crazy or like, just unusual conditions and you don't know why it's happening to you. And all you want to know is, okay, that's great that you can give me a pill, but how can I stop it? How can I stop the progression of anything? And that's what I'm dealing with. For me specifically, it's with my eyes. Yeah, I mean, for over 10 years now, I've been struggling with some weird stuff in my eyes, and just recently it's been even worse. And it's a condition of some sort where there's edema and the capillaries somehow are leaky. Not exactly sure, but I've been through about 3 or 4 specialists, ophthalmologists, retina specialists and all. And they're all kind of saying the same thing. It's telling me, they're telling me what's actually happening in my eye or what's there, but they can't tell me why. I'm like, why can't you tell me why? And I'm blown away how they don't have a curiosity, or if you're practicing now, doesn't any of our doctors ever get to the whys of things? Isn't that kind of like a big deal? I don't know. I know maybe this sounds too elementary, or am I just Pollyanna here? But I don't get it. I just don't get it. I mean, I don't want to keep going back for shots or for some other stuff, or I don't know. Or eventually an operation, or God forbid, I might lose my sight. What about other people with other conditions? And I feel for everyone here, really, as an empath. I really feel when I listen to my friends and my family, they talk about stuff and things that are happening to them. And I want to know, don't you want to know what the root cause is? I don't know, that just seems like a normal question to me. So, besides just ranting here, I just want to share with you something that is helping me steer or take control of my situation, or at least help me feel like I am, all right? It may be a bit of an illusion, but heck, it's better than the answers that I'm getting here. So what I've been doing is I've been chatting. I've been chatting with my personal AI bot. I'm serious. I actually have that. In fact, it's free. It's called ChatGPT. I'm not hawking or selling anything here, but I'll provide the link or tell you a little bit about it later on. But it's an app, and I have been talking to it, inputting in my test results, asking questions, and I'm thank God I discovered this or took the chance of like just delving a little bit past the norm or just accepting answers from my doctors, like stuff like, oh, your test came back normal. Oh, well, it's okay. No, you're not diabetic, but you have diabetic retinopathy. Go figure that one. So I have been inputting my test results or tests and asking, okay, what does this mean? What does this number mean? And it's amazing. It's amazing. The information, it talks to me like a layperson because I ask it. I say, hey, talk to me like I don't know anything about health or I'm not a doctor, in real people talk. So I have been educating myself through my AI bot here. And I've been learning a lot. And what I've been learning is I've been learning to ask the right questions when I see my providers. I wish I would have done this a few years ago, but this stuff wasn't really around then. I mean, this whole AI thing just came about now. Now meaning, the past, year or so. So I just did something pretty freaking cool. I wanted to share it with you, and I think it might help you if you're struggling with something or have a friend or family member. And so I've been showing my test or giving, what I do is I copy and paste the results from my test. I've had a lot of blood work. What else did I have? I don't know, it seems like I've had a lot of stuff. But anyhow, kidney tests, all that crap. I put that all in there, I copy and pasted. So I said to it, I really should name my chat bot here. Okay, here's the results. Could anything from here be the culprit why I'm experiencing issues with my eyes? Now, meanwhile, I've asked every single one of my specialists over and over again, every visit I said, could this be caused by so-and-so? Could this be caused by so-and-so? I would just keep throwing things at them, hoping that, bingo, maybe they'll agree with something. And not once has any of my specialists ever said, oh, maybe you should go see an endocrinologist. Or maybe it's caused by so-and-so or a kidney function or anything like that. No. I don't know if it's part of a medical practice or part of the medical culture, but it's like they just want to keep it within their realm, within their little microscope, and not offer any assistance of like helping you find the answer. Think about that. That's what drives me nuts, okay? Is that they're not trying to help you find the answer. So I asked my little bot, I said, hey, you think this could have something to do with what's going on? They said, sure. They said, here, this is what it just told me. There are additional specialists who might help uncover the root cause of your retinal issues and provide a more comprehensive understanding of your vascular health and systemic conditions. Really? That is the first intelligent statement or like slight ray of hope that I have not gotten from, my gazillion specialists that I've seen. Here are some options. Wow, how cool is that? Do you think they told me any of this? No, that's all I've been waiting for. I'm just like throwing a dart in a dartboard, trying to get an answer or response. But look, my AI chatbot just told me this. A vascular specialist, and I've been thinking about that actually, which is vascular medicine or surgery. Then it tells me why. Since atherosclerotic plaques were noted in your carotid arteries, and you have a capillary leakage in the retina, a vascular specialist can evaluate your overall blood vessel health. I'm going to tell you, I bet you that's it. But not once through the years of me questioning my specialist saying, could it be this? Could it be something else? Not once have they recommended anything other than to come back, let's do more tests, let's monitor, try these drops, let's do this shot. No, never. That just blows me away. It really does. And even the ethics of this is kind of really bothering me a lot. I don't know. Again, is my name really Pollyanna? Okay. Cardiologist. All right, I've already done that. Endocrinologist, interesting. Maybe you're pre-diabetic or another metabolic condition is suspected. Okay, they can, blah, blah, blah. A neurologist, I've actually thought about that too. Why? If there's a concern of blood flow through the brain and eyes, the retina is actually, like your eye is like, it's actually the extension of your brain. Did you know that? Symptoms like vision loss, numbness, or dizziness occur, blah, 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 they can help. And they just go on and on. But meanwhile, they talk about other specialists too. A nephrologist, that's about other stuff. Oh, I guess that's kidneys and all. But it goes down the list. And gave me some maybes. And maybe this could be the root cause. I've got more from this that took me 60 seconds to write than I have in the years that I've been going to my specialists. This is huge. This is huge. So, what's my story today for you? Because, I do care about my family and friends and those of you that follow me here. And that, I guess I am a rebel in that I will not accept a standard rote answer from anyone, including my doctors. And I bet you're getting the same too, so why don't you be a rebel along with me? Okay? We're not saying replace them. Our doctors save lives. They've saved mine a few dozen times, I'm sure, and my family and friends. But you know what, right now? I want to live longer, and I want to live a wonderful life. And I certainly want my eyesight to be there. So I want to take control, and by being more educated, at least being the person or spearing or being in charge of my own health, not just accepting what they tell you, okay? Not just accepting that, okay? We cannot allow this, okay? We cannot allow this. I'm not going to be part and parcel to just because they have the microscopic view on something and I haven't found the big picture or I didn't ask the right question. Funny, one of the answers or one of the suggestions that they have is that I seek a practice where they have a team, of people working with you to figure out what really is the issue. And that's probably the answer. So I'm going to be working on that. In fact, that'll probably be my next question. All right, now if you're wondering how the heck am I getting all this stuff, listen, there are lots of ways to do it. Yeah, you can Google it, but you know what? I don't want the whole world and everybody calling me afterwards to tell me, hey, we could sell you this or just be part of a scam or some other thing. So here's what I'm suggesting for you. I'm just trying to look for it as I'm talking right now. It's an app called GPT. In fact, I just created a video. I will put the link in the comments, or I'm going to actually link it at the end here. You'll be able to just link on it. And it tells you all about it. It's called Chat. It's all one word. Chat GPT. It's all one word. Again, I'm looking for it in the App Store so you can see what the icon looks like. Now listen, there's a whole bunch of this. It's called artificial intelligence or AI. What that means, it's an app. It's driven by the open source, which means it's available. They just made it recently available to the world of learning, or what open source AI. In other words, it's free and other people can use that engine, their logic, the data that they use in all apps and programming. But you can have the raw app, which is called called ChatGPT. Let me find it here so you know what to look for real quick. And in the meantime, watch my other video too, okay? It's this one right here. Let me show it. Let me see if you can see it. You see that? That's the one you want to look for. I know this is reversed, but that's the one because there's, I'm sorry, there. There it is. You see that? Looks like a braid. Download that one. It's free. It's free. You can pay for it, but just go the free. You don't need the paid version. And there's many different versions of that. As we get more sophisticated, we can look at other ones. But that's just helped me, and that's what I'm doing right now. And I'm just having this you can have a continual conversation. You can have new topics, but you can continue the conversation. And it's just like having your own doctor, or even, no, not even a doctor, but just someone who takes all the information out there and what you tell it, or the prompts that you give it, and it can deduct or just come up with other suggestions that it doesn't have an interest in. This is huge. This is huge. Anyhow, I hope this could help you. Anyhow, I'll keep you posted on how I'm doing. In the meantime, I just keep plugging away. All right? Listen, if you've liked this video, don't forget to hit the likey thing and subscribe. And in the meantime, listen, don't give up. Don't give up on any questions that you have about your health and, conditions or things that people tell you, or what you're feeling, okay? And again, this doesn't replace a doctor or their profession or any of that. What it's doing, it's arming you, and it's giving you the power back, okay? That's what I want. Take your power back. Please like and subscribe. It's free, and it will help me